Mulvanaka and welcome. Today we mark Fiji Day and a very happy Fiji Day to all of our viewers. Following the Honourable PM's announcement earlier, we gathered here today for a very special tourism Talanoa session with various esteemed members of the government and also from the tourism sector. Following the announcement of the reopening of Fiji's borders, we've got our panelists here with us and we welcome them all. Thank you very much for making time for us today. Our panelists are as follows: the Honourable Aiyaz Sayed-Khaiyum, the Fijian Attorney General and Minister for Economy; the Honourable Faiyaz Koya, Fijian Minister for Tourism; Dr. James Fong, the Permanent Secretary for Health and Medical Services; Andre Filian, the Fiji Airways Managing Director and CEO; Mr. Brent Hill, the Tourism Fiji CEO; and Ms. Fantasia Lockington, the Fiji Hotel and Tourism Association CEO. Welcome all and a very happy Fiji Day to you. Getting straight into it, Honourable AG, could you please speak to us about the significance of today's announcements by the Honourable Prime Minister?
Bulawinaka, and a happy Fiji Day to everybody. The announcement by the Honourable Prime Minister is very, very significant, as you know, and this obviously is a culmination of a very decisive leadership that's been provided by him through this particular process when we were at the height of the Delta variant. And the success really in terms of our ability to open up the borders is because of the rate of vaccination and the huge focus on that particular area. It is good news from an economic perspective. It's good news, as the Honourable Prime Minister said, in respect of livelihoods and jobs and businesses. And so the reality is that we have to ensure that we remain focused, is what he said. We cannot let our guard down also in respect of some of the protocols that need to remain in place. But it's a wonderful opportunity, as he's also laid down a roadmap from today onwards. There's certain milestone dates, obviously beginning today, and then the 11th of November, and then the 1st of December. So we are very excited about the fact that we'll have, the first scheduled tourism flights beginning through Fiji Airways on the 1st of December. And we also expect the number of jobs to increase in the next few weeks. We've already seen some of the hotels, they're re-engaging their staff, whether it's actually to, clean up the kitchen, get the kitchen hands back on deck in terms of the training, or whether it's cleaning up the gardens, the driveways. So it is good news, and we must take full advantage of it. We also, as the Honourable Prime Minister has said, we urge all those people who are not vaccinated, those people who are perhaps living in pockets of areas that I'm sure Dr. Fong will talk about later on, where they have very, very low rates of vaccination. We urge them to get vaccinated because then they can also participate and indeed benefit from the opening up of the borders. When tourists come, they at this point in time will only go to those areas or be allowed to go to those areas that are green zones or non-red zones, or the safe zones they can only go to. So as more and more safe zones are there, more and more people will be included as part of that. So it's wonderful news from an economic perspective, and we'd like to thank everybody for it. I'd also like to take the opportunity to thank all those who provided the vaccines to us, the governments of Australia and New Zealand, who are also our major source markets. So there is also a lot of collaboration from that perspective. The tourism people are talking to them, and we expect a lot of tourists to come from there. And also India, they provided the initial, dose of about 100,000 vaccines. And USA, of course, recently, as Dr. Fong has been using the vaccines they've given them to, give or administer to our younger population. So we'd like to thank everybody. Please take advantage of it. This is a great opportunity. Please don't let go of the protocols, and let's build our economy back together again. Naka, thanks.
Thank you, sir. Now for Mr. Koya, Honourable Minister, we've had COVID in our midst for almost 2 years now, and 20 months ago, Fiji's buoyant tourism industry grounded to a halt. And following that, what message would you have today for the almost 100,000, if not more, Fijians who depend on this industry for their livelihood?
Thank you. First of all, happy Fiji Day to everybody. I think the message is quite simple, and we must carry on with the vaccination, and that's the simplest message that can go out to everybody in Fiji. If there's one thing we can take from our reopening plans, as a lot depends on our vaccination status, and not just as a country, but as communities and as people. So especially true for the tourism industry. As you can see, what we want is to return to tourism and have some degree of normalcy in terms of the economy. where tourists can actually get off the plane and go to Nandi or cruise or do whatever it is that they wish to, and even go to an outer island. And a lot of thought has actually gone on to what's been announced today. You may want to go to a village, etc. There are red zones and green zones. So the idea is that please, everybody must ensure that they're vaccinated. And we must get to that particular stage where we're 100% vaccinated. This won't happen. You know, all of this stuff that we're talking about will not happen unless everybody is vaccinated. Our numbers are good, and its acceptance is actually quite encouraging. And we're looking at close to about 150 odd businesses that, with their entire staff, that is fully vaccinated. So it's a good start. There are a few more to come. And please, to all the businesses, please ensure that you are CFC certified. That's KFG commitment certified, because if you're not certified, very simple, you will not be allowed to open.
Thank you, sir. Dr. Fong, it's good to see you again, and we'd like to first of all commend you and all the members of the medical fraternity that have done a wonderful job to ensure that we cross the 80% threshold for full vaccinations. And looking at the protocols that have been set forth by the PM, what part of the protocols, or how would the protocols be a part of the reopening framework that will protect Fijians and also visitors?
Thank you. Thank you for that question. I'd also like to say, yes, thank you for that question. Happy Fiji Day to everybody in Fiji also. When we started this journey, there was little that we knew that could protect Fiji. And so we had to escalate our quarantine protocols so that there was stringent isolation protocols within the quarantine protocol. Today we are sitting on a different context. Today we have a high amount of vaccination. So, as with many of the other countries, we are now having a lot of what we call vaccine travel lanes happening around the world, where a group of person who wants to travel is vaccinated. He or she travels with other vaccinated persons, and they reach a destination that's highly vaccinated. So when that happens, it does remove a lot more of the restriction on the quarantine protocols, and it just means that we have to escalate the testing protocol. And that's what we are doing now. We are escalating our testing protocol so that we make sure they test before they come. They get one of those tests that we have over here. We make sure the tests are all negative. And based on the fact that they will enter into a population that's already protected, that gives us a lot more navigation room, more leeway in escalating our socio-economic recovery program. And that's, I think, where most of the people will just need to just stay COVID safe. They need to understand that because they vaccinate, because the people of Fiji have maintained COVID discipline in most areas, they have allowed our quarantine protocols to drop markedly to support socio-economic recovery. Thank you.
Thank you, sir. The next question is for Mr. Andre Filion. Mr. Filion, could you reveal what flight schedules, fares, and even package deals that Fijians and tourists can expect, and how safe is air travel now on Fiji Airways?
Well, Bula, and happy Fiji Day to everyone as well. Well, as you can imagine, we're absolutely ecstatic that we now finally have a date announced today. And we fully support the travel framework outlined by government. We've been waiting for this day for close on 2 years. We have our December 2019 schedule. This is the flights that we operate to different destinations. 84% already loaded and selling. So I'll just run through what it is. We have 14 flights a week between Nandi and Sydney. One of the flights is performed on our new Airbus A350-900 XWB every day, and the other is on our Boeing 737 MAX. We also have flights daily to Melbourne and Brisbane on our MAXes. We have daily Airbus A350 flights to Los Angeles. We have 5 flights a week to San Francisco on our Airbus A330s, and we have 2 flights a week from Nandi to Honolulu return on the Boeing 737 MAX. We have daily flights to and from Auckland, 3 flights a week to Christchurch, and 2 flights a week to Wellington on a mix of our Airbus A330s and the Boeing 737 MAX. Hong Kong will be served with 3 flights a week on our A330s, 2 flights a week to Singapore, and 2 flights a week to Tokyo and Narita, also on our Airbus A330s. And we also have to our Pacific Island countries multiple flights a day, and a week. We have Apia, we have Tuvalu, we have Villa, we obviously have Davao as well, we have Honaria, Tarawa. So all those we have our normal schedule that we had in 2019 planned. Now obviously as we get closer to 1 December, if any of the countries remain closed for tourism, we'd have to adjust that schedule. But we have all of that open for sale immediately as we're talking. We have very attractive fares for Fijians going out of the country, and we also have very exciting package deals on offer for tourists to come into Fiji. And I'll talk a little bit of some of the rates. For example, for Fijians traveling to Sydney, on economy class, they can now pay $929 Fijian dollars return, and in business class, $1,699. To Brisbane, it's the same $929. If they had to go to Los Angeles, would be basically $1,849 for economy and $4,600 in business class. These fares are 35 to 40% cheaper than what they were in 2019. So dramatically cheaper. For the holiday makers, we have very enticing holiday packages. And here I have to say thank you very much to government for that travel recovery, 40 million, that was awarded to the industry. And this is for the first 100,000 travelers, where per passenger there's a $400 stipend shared between Fiji Airways and the hotels. And this is to create packages that are airfare, accommodation, meals, and lots of other benefits at very, very attractive rates. And I'll give you an example. For 4 nights traveling from Australia to Sofitel in Denera, the price is 1,099 Australian dollars per person. Children stay free and they have to pay airfare. So if we take an all-in package for 2 adults, 2 children, that's accommodation, meals, airfares, transfers, and a lot of other benefits for 2,500 Australian dollars. That's just astounding. We have letters already from the wholesalers in Australia saying it's the best fares and rates they have ever seen in history. So these are extremely attractive packages. You asked a question about safety. Fiji Airways has right from the start of COVID pioneered what we call travel safety. In other words, we place the safety of our staff, safety of passengers, and even the community as paramount for us. And we've developed a travel-ready program that has won 2 major international awards. And I can say without question that we're the only airline in the Australia-Pacific region that has achieved these awards. The first is the Skytrax 5-star safety rating, and we're only one of 6 airlines in the world. And we've also got the Apex and Simply Flying Diamond Health and Safety rating, which is at hospital standard, and we're only one of 11 airlines. So we're extremely proud that we have taken this very, very seriously. We employed our own medical doctor. We have employed wellness champions that are medically qualified, who are on the ground and in the air to ensure that these excellent hospital standard health and safety measures are complied with all the time.
Thank you, Mr. Fillion. Now, the next question is for the Tourism Fiji CEO, Mr. Brent Hill. With this announcement today, tell us, is the tourism industry ready?
Yeah, Bula Vinaka, and happy Fiji's Day to everybody. Yes, definitely from our perspective, the tourism industry is ready. We have been preparing for this day for a very long time and been working together collectively to make sure that we're ready. We have the Care Fiji commitment, and there's already 320 wellness ambassadors that are signed up to that. And we also now have, as the Minister mentioned, 140 plus businesses that are 100% fully vaccinated. And the result of that is that they're already starting to see bookings coming through as soon as they've made that clear on their social media pages and so on. And I think from that perspective, that's the really key thing, is that we're communicating to the world that now we're open. We have these amazing value packages that we've heard about already. And when you couple that with this very clear protocols that's happening in Fiji, then tourists know that it's very safe to travel. But I think the number one thing, of course, is that Fiji is still as beautiful as ever. And I think that's the really important thing. We've been gearing up for this for a long time. We have everything here in Fiji that people are looking for. We have for family travellers, we have adventure, we have luxury, we have that beautiful combination of beaches and sun and sand. And so from that perspective, as an industry now, we know a date that we're working towards. We know that we can go out and put these offers out there, and I know that tourists are very ready to come here, and we're ready to receive them.
Thank you. Now to Ms. Fantasia Lockington, thank you for joining us today, ma'am. And looking at what's been announced so far, what can visitors, both local and international, expect from our resorts post 1st December?
First of all, happy Fiji Day and Bulavinaka, everybody. Dolovina to all our tourism vuvali from around Fiji and no doubt watching from around the world. As Andre has said, we are all wholeheartedly behind the reopening framework. That has been a really, really long but collaborative process, and we really do appreciate that the Ministry for Health and the Ministry for Tourism has consistently listened to our concerns and our challenges, and has allowed many of these solutions that they've come up with to ensure that both safety and practicality could work hand in hand. In answer to your question, Geraldine, I have absolutely no doubt that our tourism stakeholders, regardless of whether they're accommodation providers, land or marine transport providers as well, and then thousands of our industry workers, as well as the many suppliers that are intertwined with tourism, have probably jumped for joy on hearing the Prime Minister's announcement for our 1st December opening. All that the tourism industry has been doing in the last 18 months and counting has been to prepare for this particular time frame. So, along with very new and exciting features being added to resorts and tourism activity providers, everyone has had time now to refurbish or refresh their product and has made sure that the training of their staff has incorporated all the COVID-safe requirements. We've had to ensure that we can potentially identify, sick guests or sick staff, to create dedicated areas within the resorts for anyone falling ill, and to have in practice our action plans for what we can and have to do to make sure that we support the Ministry of Health's mitigation efforts to keeping COVID away. The Care Fiji certification, it's critical if you're an accommodation provider. This moves to an approval if you any other business. And for retailers and suppliers, they will need at least 100% vaccination to get their CFC recognition. All our guests, whether you are a local guest or an international guest, will be expected to comply with our COVID-safe requirements, will be expected to stay within the travel areas, and have, with Tourism Fiji, we're going to work very closely with them to make sure that the maps that will be provided by the PS for Health, identifying the no-go zones, if you are one of the villages or communities or businesses that are within those identified no-go red zones, we will be advising our local and international tourists not to come near those places, not to visit your locale. And so it's in your interest to make sure that you can make sure that your vaccination levels are increased exponentially so that you get taken off that no-go zone. So yes, our industry is very much looking forward to this start. We're very, very pumped, and we're right behind the National Airline and the Ministry for Tourism and Tourism Fiji to make sure that we get this right the first time around.
Thank you for that, Ms. Lockington. We'll have a media Q&A session, but before we get to that, there's a question that's come up from the public, and this is for the Honourable AG and also for Minister Koya. The public are wondering, if the borders are opening from the 11th of November, then why would the flights start from the 1st of December? If you could clarify that for us, please.
No, it's actually the protocols that are coming into effect from the 11th of November, because it does give people a bit of lead time, and also as the Ministry of Health will also be able to train people up to that speed. As you know, at the moment we have the 14-day quarantine, so as was announced today that it goes down to 7 days. And then from the 11th of November, it goes down to the 2 days, the 48 hours, 2 days for tourists. And as the Honourable Prime Minister announced, 3 days for the others. But the reason why it's been put in place from the 11th is that people do get used to the idea, because you simply cannot go cold from one straight away to the other. And the 1st of December flight, of course, are scheduled tourism flights. We are getting flights at the moment, and those new quarantine protocols will apply too, but they are not tourism flights. We have people, for example, expatriates who work here, they come back to work, or Fijians who may go away for medical services. So those protocols we start applying to them. And we won't get tourists as such, but for example, there could be a Fijian coming from a green zone, like New Zealand. So from the 11th of November, then they do the 3-day stay at the hotel. Of course, they have to pay for it, and that will be all booked in. There's a management system that Ministry of Health and Fiji Airways has put in place. All those bookings takes place beforehand. In the same way, when the tourists come in, as you know, the Honourable Prime Minister made the announcement that they have to do a rapid test, the tourists, before they go out of the hotel area into the safe zones. They'll be built into their hotel package, which of course the properties recover from their billing system. So that's why it's been put in place.
Thank you, sir. Minister Koya, if you would like to add on to that. Thank you. Members of the media, if you could kindly start lining up, because we'll be opening up your questions soon. But quickly, a question for Mr. Brent Hill and Ms. Fantasia Lockington. The industry, will it be rehiring those Fijians who had not been employed for the past few months due to all the COVID restrictions in place, or are you looking to hire new staff?
Well, I think the advantage with the domestic tourism, kicking off already is that a number of those staff are starting to come back into those organisations already, which is really exciting. I am in Nandi. I was down at the Radisson the other day. It was just fantastic to see so many more staff, to see music being played as well, and getting those people employed. So some of those staff are already coming back into the businesses, but also that's one of the really exciting things about this is it's a very large number of people that were employed in tourism. So from that perspective, we are absolutely looking forward to all of those people being able to come back and being employed.
Ms. Lockington?
But if I can just add to that, absolutely, Geraldine. So it's starting off with not only bringing the staff back, but it's ensuring that you've got time to train them in the new COVID-safe protocols. Even if you did not bring your 100% of your staff back this month in October, you are planning at some stage to bring them back slowly, because if we're in a situation where your property is 100% full, or you're as an activity provider or transfer provider, you are 100% full, you will have to make sure that, tourism is a 7-day-a-week sort of business, that you've got enough hands on deck, and that you can't be bringing them in at the very last minute without them having been coached and trained in the new COVID-safe protocols. As I said before, we've got just this one chance to get Fiji's reopening right, and we're very, very keen to show the rest of the world that we are safe and we know what to do.
Thank you, ma'am. Now we'll have questions from members of the media. If you could kindly come up to the mic there. Please state your name and the media organization that you're with and your questions.
Bulvanaka, Leader of Honor from Radio New Zealand. Thank you for your time. Mr. Sayed-Khaiyum, my first question, I have several, is for you. So is there any concern with regards to those villagers who are currently not good in terms of their vaccination coverage? How does the government feel about this divide between the vaxxed and the unvaxxed, given that we're about to get our main economy earner back on its feet?
I don't understand your question. What are you talking about? The gap?
Talking about the map that Ms. Lockington talked about earlier, and everyone else that has spoken, the map that will outline those villages, those communities that don't display favorable vaccine coverage and therefore will be not on the receiving end of the benefits of tourism. What is the government doing to address that situation?
As highlighted by the Honourable Prime Minister, there are vaccines available for people to get vaccinated. It's available for free. Some countries, they charge you for it. And we, of course, have the teams from the Ministry of Health going everywhere on horseback and boats, walking through the bush to get to people to get them vaccinated. So it's not the non-availability of vaccine that's creating a divide. Some countries, actually, they have a problem. Vaccines are only made available to certain people, and there is actually discrimination. In Fiji's case, no discrimination whatsoever, available to everybody. So I think we need to understand that. Secondly, as been highlighted, is that I think Fantasha may have also highlighted, and Brent would have highlighted, and so would Andre, that when we are going out and marketing Fiji, the tourists need to feel safe in terms from a health perspective. That's critically important. So tourists are now price sensitive because economically a lot of countries, almost all the countries in the world have suffered, I would say all. So they have had job losses in Australia, New Zealand too, and US market too. So people are price sensitive. People are also extremely health sensitive. So when they do a booking, they would look at countries that are safe. The fact that we are now 80% of the population is vaccinated would make us a safer destination compared to many other destinations in the world. Thirdly, the fact is they will also look at, when I do get into the country, what sort of protocols there are. Are there transparent protocols? Are there protocols that are publicly available? Is there a certification process? Yes, in our case there is. Are there places where we perhaps, could be high rates of, opportunity for us to pass on vaccination to them or for them to pass it on to us? It works both ways. So, and that's why the map is. And hopefully the map will actually incentivize people to say, look, I'm near the Coral Coast, and we used to benefit from the tourism sector. If now there's a map that says that our location is not a safe place for tourists to stop, maybe we should get vaccinated. And the Permanent Secretary for Health is making it available for free. You call him, he'll bring the vaccine to you. And they're very keen to do that. Because, from a national perspective, of course, as we have seen quite remarkably, and Dr. Fong can highlight this in more detail, is that we have seen the number of cases drop. We have seen the number of hospitalizations drop. We have seen the number of severe sort of symptoms of people suffering from COVID-19 drop dramatically as a result of vaccination. So that's the reason why we believe there's absolutely no discrimination. In fact, it's very, very good, and that is what has happened. And we want to thank everybody who's been vaccinated. And we look forward to all those people who received their first dose, which is about 96%, Doc? About 96%. So if we have all those people who've received their first dose, out of that 96%, 80% are already fully vaccinated. You've got another 16%. Then we have 96% of the target population vaccinated, which will be a phenomenal space to be in. And as Dr. Fong said, that they can of course make further announcements in that respect. The Honourable Prime Minister did say that. So we don't have any qualms about there being any discrimination as such.
If I can quickly bring Dr. Fong into the discussion. Dr. Fong, your opinion and your thoughts rather on the vaccination program, of course, being not just for locals but also for tourists, as the AG has mentioned, that it is to ensure that there is no breach in the barriers that will be put in place rather. Could you please clarify about why it's so important that those Fijians that happen to live on the fringes that have not been fully vaccinated, why they need to get themselves fully vaccinated?
Yes, thank you. I think it's important for us to understand that, if we're going to invite visitors to come to Fiji, we do need to keep them safe too. It's not only us being safe from them, but we need to keep them safe. So it's important that we highlight the areas that we're finding that we haven't got enough vaccination. It's transparent. It tells them, these are the places that you don't want to get too close to. Access to vaccines is something that is freely available, as Attorney General has mentioned. And I do have a group of people, what we call the community engagement team, who are going around. Recently, I got a call from Tamavoiwai. There were a few families there that the team came down to do vaccination, but there was a few people that were still at home. They were frightened to come. So on Monday, there is another group will go down and visit them individually at home again. So this mop-up exercise is continuing. There is no stopping the mop-up. We've got enough vaccines to actually get everybody within the age-eligible group. And we are definitely using the mop-up program to do that. So there's opportunity for vaccination. There's definitely opportunities. Nobody's stopped from getting vaccinated. And there are services, all services have been amended to ensure that it's accessed by the vaccinated. And of course, there are protocols in place. If other people decide that they don't want to get vaccinated, then they will just have to access the service in a more difficult way, but in a way that allows the rest of us to be protected.
Thank you, sir.
Sorry, Dr. Fong, will I have you? Can you talk to us about the work that you're doing with the industry, particularly with the hoteliers, to strengthen medical services in and around our more popular tourism properties, places like Denarau, the Coral Coast, for example? How are you working with FITA to strengthen their internal medical units?
Yes, we've had a lot of discussions with the tourist industry about this, and they've helped us a lot because they actually have a budget set aside to set up to actually write the protocols a bit more cleanly. We have a company that is looking into that, and once they have sorted out those protocols, they're giving us training material, and that's taken a bit of burden off our heads in terms of coming up with our own training material. We got Aspen. I think they have come up with a training program that we can deploy more easily, and that makes it a lot easier for us. So our engagement has been to the point where they are actually paying for somebody to actually build up a program that we agree to the content, and then we can actually do a lot more training in it. Thank you.
Mr. Hill, I believe you have something to add to that?
Yeah, so the program that Dr. Fong's referring to, we've engaged a third party, Aspen Medical, really experienced in this way. They're working with us on the certification. So what that means is that they'll work with the hotel industry to ensure that the key people within the property understand exactly the protocols of what happens if there is a positive case, and then what happens in terms of those isolation facilities. So that's all being worked through. We've received tremendous assistance from the Australian government, also helping to make that a reality. And also there's private enterprise as well who are setting up within Fiji, and all of this is designed just for peace of mind. We don't expect tourists to have to use much of this, but it is very much about peace of mind.
Thank you, Mr. Hill. Next question, please.
To the CEO of Fiji Airways, can you tell us, thank you for the wonderful information about how much cheaper it is going to be now for tourists to come to this country. How are you able to afford that? We know that you've lost a lot, or rather not really made any money over the past 2 years. How is the national airline that a lot of people think is struggling financially? Please clarify that too. How are you able to offer very cheap prices for people to come in?
All right from the very outset, we undertook programs to reduce costs. We set ourselves a target of a 30% cost reduction because we envisaged that once flights return, like we're seeing on 1 December, we're not going to see the same airfares, not for a long time, maybe 18 months, 2 years. So we've taken on many cost reduction programs. And one that we're very proud of, we called our revamp program. We've taken every part of the business and looked at how we can revamp it. New software, for example, for revenue accounting, revenue management. We introduced SkyBreathe, one of the best fuel management systems. And we have 65 major improvements like that. So going forward, I describe it as we are leaner and meaner business.
Mr. Villion, if I may, you said that's a leaner and meaner business for the planes and also for the staff of Fiji Airways. Are they all ready to go?
Absolutely. So we've, from day one, had two focuses. One was to survive, the other to thrive the moment borders reopen, which is 1 December. So we've had travel ready, as I've spoken about. We've had people ready. We've got flight ready. We've got organization ready. We've got ready programs right across. And what people don't realize is that during COVID, we've carried 17,000 tons of exports around the world. You know, we've got 3 flights a week to Australia. We've got 2 to Auckland. We've got 3 to Los Angeles. And we've also done 355 repatriation, which are passenger flights and charter flights. So the airline has kept going all the way through on a downscaled basis. Now we're just rescaling back up.
Just quickly to the AG and also to Mr. Villion as well, keeping in mind the flights, the PM had mentioned a no jab, no flight policy. Could you please clarify how that will be enforced?
Sure. I mean, there's obviously ways of checking whether a person is vaccinated or not. As has been highlighted by the Honourable Prime Minister, that, for example, one of the conditions for tourists to travel to Fiji, obviously, they need to be fully vaccinated. They need to do a PCR test, 72 hours before they fly, and obviously it has to be a negative result, and then they come to Fiji. So we obviously are having discussions also at the same time with our various partners, including Australia and New Zealand. There is also the fact that if you look at the vaccines that are currently being recognized, AstraZeneca, Pfizer, Moderna, and now Johnson & Johnson, that was highlighted by the Honourable Prime Minister. So the countries that are coming from, obviously there is mutual trust, and there'll be various documentation to that effect that we had already announced some time back. So that's how you'll be able to do that. Fiji has also announced that they're developing the vaccine passport, which will be used both for domestic purposes and also international purposes. You'd be surprised how many Fijians actually do travel, whether it's for competitive sport purposes, people are playing in various clubs overseas, or for business or visiting friends and relatives, because it works also the other way too. I just wanted to also highlight how critically important it has been, which we have been saying for the past 18 months, to ensure that your national carrier remains a viable option. Can you imagine if we did not have a national carrier? If there was no national carrier, even with this border restrictions being lifted and flights being allowed to come in, we would have actually been subjected to the whims and fancies of other carriers. We would not have been able to say emphatically that the first tourism scheduled flight will be on the 1st of December. It is critically important, therefore, a country that has a major source of its GDP from tourism sector, is an island nation, and indeed plays a very regional role, does have a viable national carrier. So this has been one of the critical elements of opening up the borders, that you have a national carrier that you can depend on. And of course, as you know, as Andre highlighted, a lot of jobs will now be created. You know, the number of flights that they're scheduling, obviously they'll be recruiting more people, whether it's in terms of directly recruiting themselves, whether it's flight attendants, but also organizations like ATS will need to start ramping up their operations and providing meals to those people who will be traveling in and out of Fiji.
Thank you. So we've got another member of the media that would like to ask a question. Your question, please.
Hi, good evening. Rashika from Fiji Village. As the Prime Minister has announced, schools will be opening from November 1st for year 12 and year 13 students. Some students might not be vaccinated, and as we know, vaccination is not mandatory for students, but what safety measures will be in place for students? Do they have to wear masks? Will 2-meter social distancing be applicable for them? What measures are there in place?
Thank you. To support the safe opening of schools, we have a group of the Ministry of Health working with a team from the education sector that are looking at ensuring that the schools will open up safely. I think the biggest point that we should understand is that when it comes to children and schools, like when it comes to plenty of the business places, the key words are vaccination and ventilation. Okay? If you read all the articles about masks and all that, yes, masks indoors, but not necessarily outdoors. Masks when they're sitting in crowds. So the thing that this makes it a bit easier for us because it means that we just walk in, we ensure that the spaces are well ventilated. We ensure that when they have classes, we can see them having a mask on. And if they do gather around or arrange any big event out in the school, then that's the only time when they need a mask, rather than having to police everybody at every corner of the school. So I think that the conditions required to make make schools COVID safe are slightly different from the adult conditions. But in actual fact, they are more doable. There are other things that they're going to do to try and they desegregate or put a schedule of breaks so that not everybody come out at one time. And there are a few more other things like if there are some areas that are difficult to ventilate, then they might have to look at ways of using air purifiers to try and facilitate that. But there is a group of people that are looking at that issue.
Thank you for the clarification, Dr. Fong. Before we get another question from the media, just to go back to what had been said about the PCR testing requirements, could the panel please clarify on that?
The testing protocol will require that we have access to PCR, and the PCR technology will have to be either the normal long RT-PCR or the rapid test technology. There are rapid tests around, and also we have access to the antigen tests, the rapid test kits. I think I know that Fiji Airways have a good stock. We've got a good stock, and a few other industries have a good stock. If people want to bring in these rapid antigen tests, they do have to check with us first to make sure that there's an import license that we can provide. We only allow certain types of rapid tests to come in, and they are the ones that have been evaluated and endorsed by the WHO.
Next question, please.
Bula Merioni from Fiji One. So with the borders opening up, are there plans for a national vaccine passport, a move many countries like Europe and US have taken?
Yeah, we had addressed it. We are already working on that, the vaccine passport. We have engaged a German company, and as we had indicated earlier on, about a month or so back, that we are looking at around about early December, where those vaccine passports could be available to Fijians.
Sorry, I understand this question has already been asked, but this goes again to Dr. Fong. Dr. Fong, basically the map vaccination rate for villages along busy areas, maybe where tourists would go to. Could you give us an update, where exactly are these villages located? Would you have any information on that as yet?
Sorry. The map is available already on the Ministry of Health website. We can send a link around, and that link will be generated throughout into all the public spheres. so that we could have a look at it. But they do have, you can actually see the names of the places that we consider red. The important thing is that they don't stay red all the time, that moving forward we anticipate that they will be cleared, because most of these people do have a first dose that's very high. It's the second dose that they're catching up on.
Dr. Fong, while we have you, just on the quarantine and also isolation period that was mentioned earlier on, 2 days for tourists and 3 days for the local. Just some clarification on that. What would that mean? How would that be enforced? And what are the measures that people who would be wanting to travel and also take advantage of all of the measures that have been now relaxed, what can they expect?
Yes, when we see most of the restriction will be access to these red spots that we are talking about. There is some degree of restriction that is required to ensure that we can test you. It's difficult to go looking around for people to be tested because there is a testing protocol that we have to do on day 2. And we cannot let people just go out into the community without being tested. So, as I mentioned, most of our changes have been because we are looking at a vaccinated person traveling with vaccinated persons to a highly vaccinated destination. So you got protection there. So the only thing we need to do is that test and escalate. So we're just escalating our surveillance program for travelers. And in some instances, it may mean restricting some degree of movement just to ensure that they are tested.
Thank you, Dr. Fong. Now to Minister Koya. We've, of course, seen the great results of the Love Your Locals program, and with some of the measures that had been relaxed due to our vaccination rates that had been increasing over the past few weeks, if not months, we've seen a return to local tourism. But looking forward to the future when international borders open, this is both for Mr. Koya and also for Mr. Hill. What can you say about some of the packages or some of the incentives in place to entice tourists, both local and also international?
Thank you. Good question, actually. We have had a good discussion with all the operators at the ministry level and also with Tourism Fiji to ensure that our locals aren't forgotten and that continues. The Love Our Local program doesn't fall by the wayside, and it's not about just international tourists actually coming into the country. So we've had some good, serious discussions with the operators who are okay with that, and they will continue to ensure that our locals are taken care of, because the same way they were when we didn't have the tourists from overseas. And the packages shouldn't differ too much from what's being offered now, but there was quite a good uptake from our locals in that particular program, and they may continue to enjoy that.
Mr. Hill?
Yeah, certainly. I think the really exciting thing is that, some of these offers that are coming out, I think Andre mentioned before, at prices that we haven't seen for some time. And so the packages that include return airfares, 5-star accommodation, and food and beverage, which is quite amazing, at prices around the $1,000 mark out of Australia and just over that in US dollars out of the US as well. I think we're already seeing an increase on our website. We know that there's people really interested in coming to Fiji. I think when they see these price points, that there'll be quite a rush. So we're quite excited about the release of those packages. Yeah.
Any other questions from members of the media?
Hi, Lydia Mavona from Radio New Zealand again. The question is for Dr. Fong. Can you tell us about your preparations for a possible third wave? Also, maybe help allay our fears from international reports that the third wave is reported in some countries to be more ferocious, maybe more dangerous than the Delta that we're facing now.
Yes. I think you'll have to. One of the most interesting comments that I read this week came out from Singapore, and they did discuss the fact that Singapore, compared to us, was considered COVID naive. Even Australia, New Zealand, to us they are relatively COVID naive because they haven't had the Delta. We've had the Delta, so one of the it's a terrible advantage to have, but all all the good things, all the bad things have to come with a good thing. So we've got it, and it swept through us very fast. On top of that, it hit us at a time when we were highly vaccinated. What I do know is that when I see the behavior pattern in the community now, it is different. I do know that there are a lot more believers in COVID safe measures. People have taken to heart the requirement for COVID discipline. What that does is that means that if the virus moves in Fiji, it will move much, much slower. It will be slowed down by the fact that we are vaccinated, and it will be slowed even further by the fact that we got people who are COVID safe. Because it moves slower, it means that we have the ability to contain it faster. That means that we won't have overburdened health system trying to struggle with a huge load of people at one point in time. It means that if cases are going to come in, it will trickle in, and we can identify them early. There are other measures being taken. There's something called the line listing. We have that will be in all the emergency operation centers that will look at vulnerable people to be line listed even before they become positive. There has to be virtual oversight over them. Those who live in unvaccinated areas, we have to look at that area and then look at them being line listed and create virtual oversight. The idea is that those who are vulnerable need to be seen early and moved fast. But the majority of us don't need to be moved anywhere. Even if they do get sick, there will be just a few people on our positive case list, active list, and they will be watched over through either virtual means or through outreach. That's one of the things that has happened to us about COVID-19. It has given us a level of wisdom about how to reorganize our health provision program to be able to deal not only with this epidemic, but with any outburst of disease. And in fact, it has reoriented our whole healthcare program to a different way. We are looking at things like reducing the amount of people that need to come for SOPD clinic, providing some degree of telehealth to them rather than having them to, even if it just means talking on the phone to them rather than having them to front up at the clinic. All those are changes that are happening for the purpose of dealing with what we feel is a field where the virus can only move slowly.
Next question, please.
This question is for Dr. Fong. Dr. Fong, it seems that some of our enforcement bodies are not doing their part with regards to enforcement of wearing face masks. Yesterday, after work at the Suba Municipal Market, maybe more than 40% of people were going around without wearing face masks, and there were no enforcement officers. I understand the police are not the only enforcement officers. Maybe you can tell us who are the enforcement officers and what is being done to address these sort of issues.
If I may assist also, it's not just the police that actually do this, it's FCCC. We have COVID safe ambassadors around the place. And if there are cases like that you hear of, please, all you have to do is just report it to the ministry, either MCTTT or the Ministry of Health. But generally speaking, there's been a great deal of compliance from a lot of people. Just going back a little bit also, the only reason why we're actually able to do this on the 1st of December is because there's been a behavioral change right around Fiji so that we can do it. And you've seen it from the positive results that we've got in terms of vaccination, etc. And that needs to be looked at. We can't always look at the negative. Maybe a bunch of people were there without a mask. It's going to happen. That's something we have to live with. But we do have people on the ground, and they are from FCCC, the police force, and also from the ministry at all times. And it will continue to happen, especially in light of what's actually happening.
And those people should realize, I mean, you're talking about supermarket, if, say, for example, a group of people in Nandi market did that, they should realize that the tourists won't come to the market. If people in other places of business where they're selling their, produce or goods and services, they won't come to your outlet. So there's a direct economic impact on you. And as the Honorable Prime Minister said, that we cannot let our guard down in those areas. The PS for Health is also saying that, Health and Medical Services, exactly the same message. And so, we should not, and I think it is a moral obligation, if you saw those people, as journalists, you should have the phone numbers of the police officer in the police post. You could have gone down and informed him, or called FCCC, MC-T-T. They're there, they'll come and, book those people or issue them with the fine.
This is a question for the Honourable AG and also for Minister Koya. You had mentioned the CEF certification or the Care Fiji certification. Could you please provide some clarification on what exactly are the requirements and what measures will be put in place once a particular retail or business outlet does receive the CFC?
There's a handful of things that you need to go through. I think Brent will actually can specify exactly what it is. And there are properties that want to operate must have that. Without that, you cannot operate. You will not be permitted to allow tourists to enter your premises if you are not CFC certified. And there's a whole host of things that need to be ticked off in terms of COVID safe protocols that health has actually given to us. And it is an important tool in this in the opening of borders. And not only that, I think it's also for our locals. It's very important, just the same way we did with the businesses. You cannot open unless you actually comply with these protocols. But just the finer details, there are a few things that I think Brent might want to just speak about quickly, just to let you know.
Yeah, it is a very detailed program. You actually have to go into a Google Classroom and actually go through a whole range of points and then pass some tests to be able to get to that level. And I think, as Fantasia said earlier, there's actually 3 layers to it. So for hotels and resorts, they can achieve the certified standard, which is required because of the higher element of things like isolation and testing. Then we have the certified level, which is things like transport providers and so on. And then if you're just a retail shop, you can still go through it and get 100% vaccinated Care Fiji sticker and accreditation that you can use. And again, the way that we're going to be communicating that, we're looking at having things like billboards and so on, so that when the tourist comes into Fiji, they'll actually see these signs saying, look for this symbol to stay safe. So again, we're encouraging businesses everywhere to sign up to that Care Fiji commitment. It is really strong, very robust. We have that third party, Aspen, who are also checking through to ensure on compliance. And so from that perspective, it's all about providing real peace of mind to the tourists that they're well looked after. And if they use Care Fiji commitment operators all the way through, then they should be able to stay safe.
Ms. Lockington, I believe you have something to add?
Yeah, I just wanted to add very quickly that the key word is commitment. So it's consistent, and that commitment means that you know what you're supposed to do in terms of keeping your business, your staff, as well as your guests safe. And the commitment part of it is making sure that you continue to do that, which is what we're all working together to make sure that we do.
Dr. Fong, there's a question from the public who would like some clarification. Someone has asked, do tourists who come from Australia who are fully vaccinated from the 1st of December onwards, do they need to quarantine in Fiji before their holiday in your approved green zones?
I think we've discussed the protocols that we mentioned from the 1st of December. We are just looking at a protocol that allows us to test them. That is the only restriction that they will have. Is that whatever we do, it will be for the purpose of testing. They will stay within a safe travel area, at least for the first 2-3 days while we try to sort out that test negative that they need to have. So it is much the same as what we have discussed previously. We are reducing what I call the most stringent part of a usual quarantine program, because that protection has been overtaken by the vaccination and the COVID safe measures that we have around.
Sorry. It depends also. If you have a tourist coming from Australia, it could be, what they call VFR market, so visiting friends and relatives. So if, for example, I'm a former Fijian and I now live in Sydney, and I want to come to Fiji to spend some time with my cousin who lives in Vatugrasa village. Now, that means I'll be living in the community. And so when I do come, I still have to do 3 days quarantine in a designated resort that's been certified. I stay there, I do my test, then I can go out. I don't have to come back to the hotel. For the tourists, they do 2 days and then they do their rapid test. They can then go to the safe zones for the day. So if I'm staying in the Fijian, I can go and, go to Tapus to do my shopping, or I may go to some restaurant that's been certified, or I may go on some tour up the Singatoka Valley, and that tour, company has been certified. I can do that, but I come back to the hotel. VFR is because once they go out, so once I may go to my Vatugrasa village, I may from there go somewhere else in Fiji. We don't keep a track of you. So this is the reason why they stay there for 3 days, and they do another test. So that's the point of difference. So, when you have tourists coming from Fiji, there could be 2 types of tourists that are coming from Fiji, which the Prime Minister said there are actually 3 categories. You have the tourists, you have the VFR, and the third category being, for example, you may go off to some press conference in Sydney. So when you come back, what are the rules that apply to you? So that's the third category of people.
Thank you for that. So this is also another question for the AG. If you could tell us about medical insurance, especially for tourists that come into Fiji, is it something that they will require, or is the government planning on setting aside a certain budget to cover for what may come?
We have said that we are talking to Fiji Airways and Ministry of Health, obviously, where we will be building a small premium for tourists into their ticket price. And that's essentially to cover the cost for Ministry of Health, unanticipated costs. So the best way to have insurance against that is actually take out an insurance cover for that. And we're looking at this stage in time. This stage in point is about $30 to $40. So we've tested the market because it may well be, God forbid. So for example, if there's a tourist that may be, say, living at or staying at Natandola, and if they get quite ill, and they need emergency, ambulance to take them to Lotoka Hospital, we will obviously have to bear the cost. Ministry of Health will have to, divert resources to that. The Fijian government will. So we have to have insurance cover for that. Or assuming that if the islands do open up, somebody needs to be, airlifted or by a chopper or brought by boat. So that covers that, and any of the, costs associated with that. There could be people who may, for example, fall ill. They may not be that ill, but they may need to change the airline ticket because it may be recommended that you need to do that. So sometimes there's costs involved in that too. So that can cover for that cost. In respect of them taking out insurance cover before they get to Fiji, obviously it depends on the individuals themselves. We cannot at this point, we have not mandated that, but a lot of people may do that. In fact, a lot of people may find it hard to get insurance for traveling overseas for holidays at this point in time by insurers overseas. But from our side, we're looking at building that into the ticket price, which we'll then collect from Fiji Airways and other airlines too. Thanks.
Thank you for that. So, Ms. Lockington, a question for you. Given that the PM had mentioned that right now outside of Vitilevu, some of the outer islands are still not considered as safe or as green zones as we would call them for tourism to resume in those areas. But could you give us an outlook as to whether or not resorts in those areas are ready to receive tourists if and when we receive the green light for those areas?
It's a good question. And yes, they are absolutely ready. Many of those resorts are chomping at the bit, so to speak, that, come the freedom provided by the Ministry of Health that we can have visitors go all the way. And even now with domestic tourists not being able to go across has been quite a setback for many of these smaller resorts, and most of them are very small resorts. So they're working within the areas that they're based in by talking to their staff. The staff come from those communities to make sure that they can help support in whatever way they can and encourage those numbers of vaccinations to go up. And we've been working very closely with Dr. Fong's team to make sure that we can identify those areas and help however we can to get those numbers up, because it's important for everybody.
Mr. Hill, a question for you. Earlier on, we had asked this question, but just to go back to it, the PM had mentioned that once travel resumes, international travel resumes to Fiji, of course, the competition will be very high, and so we need to have something that may be quite extraordinary. For the incentives that some of the resorts and, of course, some of the packages that Fiji may have to offer, could you detail them for us?
Yeah, I think that's the thing. We are in a competitive landscape, but I feel really strongly that as we emerge out of COVID, that Fiji does have an advantage over some of those other areas that may not necessarily be able to open until potentially the middle of 2022. So we've got a really good opportunity to get in front of people, particularly in Australia and New Zealand, but also in the US and so on, and tell them about what we have to offer. Fiji naturally is a place that people want to come to because of everything that we have in abundance, clear water, snorkeling, golf, diving, all of these amazing things, and such a broad spectrum of accommodation from family right through to the uber luxury sort of side as well. And one thing that we're actually seeing already is some of those bookings are coming in anticipation of an opening, and now we've got the clarity of that date. I think they'll come in even stronger. But I think when you do see those offers where you've got not just the return flight and the accommodation with Fiji Airways, but you also have food and beverage, that's almost unprecedented. So I think for people to see some of these packages at $999 or 1049 Australian dollars or US $12.99 from America for a week's stay, flying with Fiji Airways, I mean that is incredible value. And so I think from that perspective, what we're looking for from Tourism Fiji is that, this will bring whole new sets of tourists to Fiji and people that may not necessarily have thought about us before. So Americans who might have gone to Hawaii, now they're going to have their heads turned by how good these packages are and come across to Fiji. So yeah, we're really looking forward to literally from tomorrow getting this out to as many people as possible.
Thank you, sir. A question for Mr. Fijian. Given what Mr. Hill had said, being that Fiji needs to be as attractive, looking at what you had going back to what you had said earlier about the number of flights that we have, and in anticipation of the tourism market, of course, growing as quickly or as rapidly as possible, could you tell us whether or not whether Fiji Airways research says that you will be able to cater for that once the influx or the surge of demand for flights and also holiday destinations come in?
Yeah. As I mentioned earlier, we have our December 2019, which was a peak travel period for us. 84% of it loaded out there selling today. And, just talking further on the packages that Mr. Hill spoke of, we've worked with or collaborated with the hotels and the industry to put these amazing deals together. And obviously, in anticipation that this is going to be or create great demand, we've made sure, as I mentioned, we've got 84% of our prior schedules out there selling.
Can I just mention that kind of from a macro perspective? Yes, Fiji is attractive. We have to be mindful of the fact that some of these countries will very quickly catch up in terms of the vaccination rates. We have spoken through some third parties to some of the properties in, for example, places like Bali, and they were looking at just slashing their pricing, because the competition here is not just about getting people to fill up the hotel rooms or your planes, but it's to actually capture the market. And I think what Brent said was really important, is that there may be people who will now come to Fiji who did not think about coming to Fiji before because of these packages, but also because of our ability to manage the health risks. That is critically important. If you have, your husband and wife, 3 kids, and they feel very confident that the health protocol measures in Fiji are very good, and as a result of them coming from the 1st of December, a lot of people will have a wait-and-see game. They'll see the first lot of tourists come to Fiji. Does anything come out of it or not? Then they may decide to come in January and February. So all of those factors do matter. So for us, we made this decision some time back. A lot of people have said, you reduced the duty on alcohol. Why did we do that? And the excise was because we wanted to, as Brent was saying, make ourselves attractive, not just for Fiji Airways to take a clip on its pricing, but also to ensure that the hotel properties bring down the price of food and beverage. So even though we've reduced the duty on alcohol, for example, they should bring down their margins also, but try and work on the volume. That's critically important. They need to work on the volume to capture the market, because once you have a captive audience, once you're able to bring them through the doors and they're able to see what a fantastic job our Ministry of Health and Medical Services have done in respect of vaccine rollout, the certification through MCTTT, the Hotel Association, the airline being certified internationally, they will see that all these sort of the clogs in the wheel in Fiji function well. So they'll say, this is a destination we want to go to in this COVID-19 world.
While I still have you, sir, as you mentioned, of course, managing the health risk is, of course, very, very important. Sometimes that does play a role in whether or not visitors would want to visit a country. Now, the PM had mentioned that there are certain countries where visitors who come into Fiji and when they return to their home country, they may not have to quarantine when they return. Are there talks in place with those countries to about this?
Dr. Fong may have had some discussions. We've had through, from a kind of economic perspective, had some discussions with some of the countries. A lot of them, of course, are evolving. As you see, like, for example, a country like New Zealand, their position on COVID-19 has changed dramatically, over the past few weeks, in fact. So it's an evolving issue for them. I think the fact that bulk of our vaccines came from Australia and New Zealand, that the Ministry of Health and Medical Services are working with them very closely. In fact, the DFAT is working with the hotel industry and Ministry of Health in terms of the rollout of the protocol measures, the certification process, will ensure that they have confidence in our system. So if they have confidence in our system, they won't place highly stringent requirements on their citizens when they return home to Fiji, to Australia after their holiday. So I think that's really the key. So it's to develop the kind of the trust pathways, if you like, with the different countries. And once you have the trust pathways set up, then it becomes a lot more seamless and easy.
Speaking of trust, Dr. Fong, this is a question for you. Given that we haven't reached 100% of the population getting even their first dose, of course, you have said that we do happen to have some Fijians who have not been vaccinated, not even fully. With that being a risk, do you think that it could play a part in the resurgence of COVID cases once the borders have been reopened?
Yes, thanks. I think I've mentioned in a few other briefings that to a large extent, the more people are vaccinated, you actually do protect those who are less vaccinated or unvaccinated. There is a protection there. And I think that as you move forward, we've got, I'm quite impressed with our escalation, our deployment plan that we did between the ages of 15 and 17. We had a huge number of proportion of those between 15 and 17 are vaccinated. The percentage is quite high, but I just don't want to talk about it because I have to make sure of my denominator before I start talking. I do know that we have solid plans for vaccinating those from 12 to 15. In fact, we have actually already written up all our protocols for that for the Pfizer rollout. So we are confident that as you continue to vaccinate more, then those who are hesitant, they actually get more protection out of it anyway. Apart from that, there have been an escalation in the COVID care plans. The COVID care plans has been one of the most interesting part of this journey for most of us in the medical service, because we have refined those COVID care plans to be able to actually get in touch early with those who need the care that needs to roll out.
Vinaka for that, and with that it wraps up today's Talanoa session. We'd like to extend a big Bula Vinaka Vakalevu to everyone and a very happy Fiji Day. Thank you very much for making time for us. To our viewers, we hope that you stay safe and enjoy the rest of your Fiji Day. Naka.